Hello, I'm Steve Eager. We've reported that cases of RSV, a respiratory infection that affects mostly children, are near record levels locally, and there is concern among pediatricians that Thanksgiving gatherings will make it worse. Fox 4 Sean Rabb is in tonight with more. Sean.
And if you have a toddler, especially an infant, the director of infectious disease at Children's says keeping your child healthy may mean keeping other people away from them this holiday season.
For a virus, this is an ideal time to spread throughout the population, so I think people have to be very, very cautious.
And Thanksgiving travel will make it easy for the virus to spread.
But there's certainly going to be a lot of mingling with family, and there's an opportunity for viruses to jump from one person to another.
Dr. Jeffrey Kahn, director of infectious disease at Children's Health and professor at UT Southwestern, says parents need to take steps to try and prevent children to possible exposure.
Try to limit the number of people who are touching or holding the baby. Anybody who holds the baby has to wash their hands. If anybody's sick, of course, really limit contact with the baby or have them wear masks. So these are the types of things that will be very, very helpful in trying to reduce the likelihood of the virus spreading from one individual to another.
There is a vaccine now for children and a vaccine recommended for expectant mothers.
So if you're a pregnant woman and you're expecting to deliver anytime between now and March, you can get an RSV vaccine at between 32 and 36 weeks of your pregnancy. That will actually help protect you from RSV, but also will protect your newborn infant from RSV.
A runny nose may be the first sign of the virus brewing.
They'll start developing symptoms 2 or 3 days after exposure, and typically it starts with really mild symptoms, just congestion, that tends to worsen over 2 or 3 days, and in some cases can lead to rather significant respiratory tract disease.
Like pneumonia and lung infection.
We do know that the children who are most susceptible to severe disease tend to be less than 6 months of age, and particularly those less than 3 months of age. So if you have a child who fits into that category, then be very, very careful with them, particularly with a lot of people gathering during the holiday.
Now, late last week, the Centers for Disease Control expedited the release of more doses of Beyfortus, the monoclonal antibody treatment that can prevent severe illness. But hospitals and pediatricians have been hard-pressed to get doses of the drug because of what the manufacturer calls an unprecedented demand nationwide.
All right, Sean, here's to a healthy Thanksgiving. Thank you very much.